Botwin, and I was in Delta Phi Epsilon. There goes the cell phone. I shut my phone off. You might want to shut your phone off. So embarrassing.
Little T-Swift. Sorry, my phone's really broken.
Don't worry about it. So I don't know if you guys have heard of Hofstra University, but that I was in Delta Phi Epsilon. I'm making a face of thinking a long time ago, but I graduated from Hofstra in '93, so I joined the sorority second semester freshman year, and then I did it the whole time, and it was like one of the best things that I've ever done. Obviously I'm here tonight to talk about eating disorders, and I'm going to talk some about my own experience in being recovered, and also I'm going to talk some about my work. I've been working with patients who are trying to recover since I graduated in '93, so since around 1996. I started out at the Renfrew Center. I don't know if any of you guys have ever heard of that. It's like one of those, I see some people nodding. So it's a place where people can go if they're really struggling and they want to kind of leave school or leave their home and make that their focus. So I worked there for a couple of years, and then I started working in private practice. So right now I'm in Bala-Cynwyd, and I'm also in Shari, New Jersey. So that's just kind of my history. I feel like I recognize some people. Is anyone here tonight? Were you guys here 2 years ago when I was going to say? I can it's so funny because I'm like, I totally recognize. So I don't remember exactly what I said 2 years ago. So probably some of it's going to be different. One of the things about recovery from an eating disorder is it definitely changes as you go through your life, and different things happen. And when I came to you guys 2 years ago, I was trying to get pregnant. I'm a single woman, and I decided that I really wanted to have a baby. I'm sort of older. I don't want to say exactly how old I am, but so during that year, I was actually going through a lot of fertility stuff, and which definitely affected my issues with food and weight. And then I talked to you guys. I think it was actually the same week, right? So I got pregnant in July, and I had a baby. It'll be a year, March 30th. So, and I was texting the babysitter on the way over here, what is he doing? Is he sleeping? So it's the best thing ever. So I'm sure some of the things that I'll talk about tonight, it'll be different from 2 years ago. Just because when you go through any life changes, it definitely can stir up feelings about weight and food and body image. So I think one of the things I want to sort of make sure I preface, and I may be a little redundant, but that's because I think some of this stuff is so important to say, is that if you know someone who's going through recovery, or you yourself have struggled with an eating disorder now or in the past, it's one of those things where it can kind of come and go. You can go through a period of life where you're doing really well and you're feeling good about yourself, but then something might happen, and the different thoughts and feelings about food and weight can resurface. At this point in my life, I don't really feel bad about that. If I'm going through a period where I'm struggling, I don't think that that's a horrible thing. I don't think it means that I'm not good or I'm not well. I just think it means that, okay, well, clearly there's a lot of layers to eating disorders. So now that I'm pregnant or I've just had a baby, there's other things that I'm thinking about that I didn't even think about before. When I went to college, I would say that for me, one of the struggles I had, and I'm sure some of you can relate to this, is that being in a sorority was amazing. I just made so many close friends, and I felt like I had a place where I belonged. But there were times where I also was very competitive and comparing myself to the other girls in the sorority. I think the worst part about it for me is, and one of the reasons why I like to come out and talk to people, is I really didn't tell anybody that I was struggling with any of this stuff. I think some of my friends knew I was self-conscious, but they had no idea how severe it was and how much I worried. And I would do that thing where, you have a lot of events and there's usually food at the events. I would miss events just because I didn't want to have to worry about the food. So I wish I could have told people or said something, because I think now, at this point in life, people can talk more openly about eating disorders. I think there's still a lot of stigma, but I don't think it's as shameful as it was 20 years ago. So that's one of the reasons why I come out and I sort of just stand up and say, yes, I've struggled with an eating disorder, as a way to just say to you guys, I don't think it makes you a bad person. I don't think it makes you less of a person. And I think in some ways, for me, having had an eating disorder and gone through years of therapy, it actually makes my life better, because now I can like have issues with food or think about it and then understand, oh, that means something else is going on in my life, and I'll get to that other thing, and then like I'll make that other thing better, and I'll deal with that other thing, and then I'll actually be happy and like go through another period where I can like just be free with food, with my body, with my relationships. So one of the things I just wanted to ask you guys before I sort of ramble and talk a lot is, what do you want to walk out knowing? Like, if you don't, it's not even like a question, but like more like, are there certain things that you think you want me to focus on tonight so that you have a better understanding? I don't know if you guys thought about this at all before you came.
I guess like a thought process, or what goes through your head when you're dealing with food and your self-image.
Okay, I could definitely address that. Is there anything else? I don't know if anybody is a friend or a family member of someone with an eating disorder and wants me to talk to some about that also, because I know that that can be very difficult. I don't know if there's anybody in the sorority in the last few years that has struggled with an eating disorder or is struggling, and maybe you don't know what to do or what to say. I can definitely address that. Is there anything else you guys want me to focus on? Because one of the things I was saying to Allison is I can definitely talk a little bit about some people I work with who are in college and are seeing me or have seen me for therapy. Just because the thing is, again, like it definitely will change as you go. I'll just sort of give you like a background of my eating disorder. When my eating disorder started very young. I was probably like 7 or 8 years old. And at that point in my life, I was just not in a good situation. I did not come from a happy, safe family. So a lot of my eating disorders were revolved around trauma. It's not like that for everybody. So I'm not really going to talk specifically about my trauma stuff, but I will say that for me, using the food and eating the food actually got me through some really bad times. It was not like something that I planned. It wasn't like I woke up one day and said, maybe if I eat a lot, I'll feel better. I just kind of did. I had a lot of times, like when I wasn't going to school, like in the summer, where I basically was on my own through the day. I was hanging out at a swim club. There was a snack bar. I knew where to get money out of like a piggy bank. So I would go to the piggy bank in my house and just go and eat and buy food. That kind of cycle for me went on probably until I started to become like a teenager. And then, and I'm sure a lot of you guys know this, when you start like going through the whole puberty thing and then the body image stuff, for me what happened was people were actually commenting on my weight, saying like I shouldn't weigh what I weigh, I weigh too much, even though looking back I think, well, that's kind of not really true. But at the time I thought, well, if people are telling me I don't look good, I weigh too much, so I better do something about it. So I started just going on diets. When I was like 12 or 13, I started exercising a lot. I was comparing myself to the other girls. The stuff that was going on in my family was still the same, so it wasn't like anything got any better. But for me, at that point, losing weight was actually like a motivating thing. It like gave me confidence. It made me feel like, well, at least I'm good at something. I was not doing any therapy. And again, when I was 13, I don't even know if people really knew what eating disorders were. I think people were just starting to talk about it, but I clearly wasn't going to be identified because I didn't look like anorexic. One of the things I just want to make sure you guys understand is you don't have to look anything to have an eating disorder. That's such like a myth. Anorexia doesn't mean that you just don't eat. There are definitely some people with anorexia who like stop eating and they might end up at like CHOP, or they might end up at a hospital like being put on feeding tubes and stuff. Those are like severe cases in the sense that those particular women are really struggling with symptoms. For me, it was more of a thought thing. I focused on food all the time. Like I thought about it all the time. I thought about what I could do to not eat. I thought about feeling that feeling of hunger and like feeling like that was a good thing. It doesn't make any sense. It's irrational. But like when you're going through stuff, and for me it was trauma. For some people, especially in college, it's going through like family stuff like divorce. Some people, like some of the girls that I've worked with, they start developing anorexia because they've broken up with a boyfriend that they've been with. I've known a few girls who started their eating disorder in high school because they like want to go away to college and they like want to be smart, but at the same time they're really scared. So some girls, like there was this one girl that I knew who right before she was supposed to leave for college, like 6 months before, just like lost all this weight and became full-blown anorexic because she didn't want to have to like deal with like moving out of her house and being on her own. She like wanted to go to school, but she didn't want to go, like she was kind of conflicted, so she was torn. So that's like another situation. Some people, you know, who are in college will go through eating disorder issues because they're dealing with competition stuff like sports, or even just the idea of going to college and trying to figure out, well, I had a lot of friends in high school, is that going to happen when I'm in college, am I going to fit in? So there's a lot of different reasons why people will go into eating disorders. There's not really any rational thought process to it. The way I would describe it is that it just takes up all your time. And it's like that for anyone struggling with food, whether it's overeating, binging and purging, doing what I did during like middle school, high school, and college, which was trying not to eat or over-exercising. I guess the thing that I would say is that if that's something that you do or that you know someone else is doing, there's probably something wrong, and it could be anything. I mean, I could probably sit here if I really thought about all the different people I've known through the years and tell you different reasons why people have developed an eating disorder, and a lot of the reasons sort of have similar themes. I think one of the biggest themes with eating disorders, no matter why you have one or when you get one, is you feel somehow like you're not a good person. For me, I felt like all the things that were happening in my house, I thought that they were my fault. Nobody ever actually said that. I just decided, well, if there's things that are happening to me that shouldn't be happening, I'm probably doing something to cause that. Now that I've been through years of therapy, I know that that's totally like not true. But it wasn't until somebody else from like outside of my family or totally removed from my life told me that I could even fathom that that wasn't actually true. So one of the things with eating disorders is it's very like self-destructive. It's one of those things where you might not realize how bad your self-worth or your self-esteem is, but it's probably not so good. Because if you think about it, if you have good self-esteem, then why would you be doing things to your body that aren't good for you? And again, it could be any symptom or issue. Are you guys following me so far? I came with like an outline of a bunch of things to talk about, but this particular group that I talk with, this age group, it's one that is very, it's very close to me because I went through so much with my eating disorder in college and I told no one, so I feel like I need you guys to kind of guide me in terms of which parts of my story do you want to hear about, or about patients. I don't know if just sitting here now, anybody has any thoughts or comments?
So one of like the facts that like we learned this week was that like a lot of people with eating disorders have the same symptoms as people with depression, which is kind of what you just said. But then I feel like there's this like complete opposite side where they like the eating disorder, like it does make them confident, like they do feel pretty and they don't want to change, and like can you talk about that side?
I'm glad that you brought that up because I think that until I went to therapy, I didn't really understand. Am I depressed and then I got an eating disorder, or do I have an eating disorder and am I depressed? Most people with eating disorders definitely struggle with depression. I think there are some people, I call it like masking. You know, if you know someone that has an eating disorder and they seem like they feel good about it, or they think it's a good thing, I don't actually think that that's really true. I think it's sort of like a cover-up. We can convince ourselves that our lives are great or that we're feeling good even if it's not true. Sometimes what the restricting does, or the binging and purging, or the overeating does, is it's sort of like a temporary fix to the depression. Like it can make some of those really bad feelings about your body and yourself temporarily like go away. I don't know if you guys can relate to this, but if you think about when you're really hungry, if any of you have ever gone all day and you're like, oh my god, I haven't eaten, and you like kind of feel like you don't even know what's going on. You're kind of like numb. Like somebody today, for instance, came in to see me. She works the night shift. She came in to see me. She hadn't eaten like anything. So she sat in my office and like she was totally spaced out. She was numb. She didn't seem as depressed today, but like she couldn't really feel. Like it was almost like she was in the room, but she wasn't really in the room. So I think that sometimes what happens with eating disorders is people, when there's denial, because there can be a lot of denial, they can convince themselves and others that they're okay and that they're not depressed, but I think it's a really depressing disorder. I think one of the things that I wish I could go back and change was that and I don't think it's just me, I think a lot of girls struggle with this, I missed out on a lot. Like, you have all these events with the sorority, you go through the pledging, and then you are a sister, and you have all these different types of events. It was kind of like I would be in the event, but like I was thinking, if I don't eat this, and if I don't eat that, and like I don't really, it's almost like if you said to me, do you remember like your formal, like your sophomore year, or yeah, I remember going, I don't really remember how I felt though, because I think most of the time I was pretty empty and vacant. The only thing I think, again, I think that what the sorority did was it helped me to keep my eating disorder within, like, I don't know how you would say this exactly, but it kept me out of a hospital. And I think when I say that, what I mean is I did eat. I didn't not eat. I definitely, like, went through periods where I ate and periods where I was like, but I really want to have fun, or I love these girls, or it's the first time in my life I feel comfortable. So one of the things that I would say is that if you know somebody or you yourself are sort of struggling with this and you're not sure, am I depressed, am I happy, I would just say, again, if you're using food in a way that's hurting your body, you're definitely not okay. Does that mean that, like, you should leave school and that you should quit your sorority? No, it doesn't mean that. It just more means, it's kind of like, it's like a red flag. When I start to go back to that place, when I first had my baby, I definitely was struggling because I'm a single mom. I don't have any relationships with people in my own family. When I don't know if you guys know this, but when you have a baby, you don't just lose weight. Like, it's not like, oh, I had a baby and I'm back to my pre-pregnancy weight. You lose, like, some water. Andrew comes out to me and I'm like, well, I feel a little better. But you don't just go back. So initially I was feeling like, oh my God, like people are going to think, why didn't she lose weight? And like after 3 months, I'm thinking people are probably looking at me and they're thinking horrible things about me. So what I had to do, and this is after years and years of therapy, instead of like acting on those thoughts and feelings, I was like, wait a minute, there's something going on here. Like, I can't be not eating. Like, I have to take care of my baby, and I can't be worried about what other people are thinking. So what I realized was that what I needed to do was kind of accept that, well, this is like the best thing that's ever happened to me. I'm definitely feeling a lot of loss because I don't have people I can share it with in terms of like biological family. I knew that was going to be hard. Before I had a baby, conceptually, I'm like, are you going to be able to do that? But I didn't actually know how it was going to feel. So once I could kind of like be like, wait, what's going on here? Then what happened was I could direct my energy towards the issues, and then I became more comfortable again with the idea that I weigh what I weigh, I just had a baby, who the freaking hell cares what I look like? I don't really, like, I had a baby, like, I don't really care, and I was able to kind of put the energy back where it belonged. So I would say that one of the main things with eating disorders is that it's a defense, it's like a distraction, and I'm sure all of you can relate to that. You don't have to have an eating disorder to understand that when we're going through hard things, we don't want to have to feel it. Like, if any of you have issues with conflict, you're probably thinking, I don't really want to tell that person I'm mad at them, or maybe I can try not to be mad at that person. It's sort of the same concept. If you're thinking about food, or you're eating food all the time, or you're not eating, or you're binging and purging, you're probably avoiding something. I don't know if that makes sense to you guys. As I'm saying more about this, is there anything else that you guys want me to focus on?
If a friend tells you that they have an eating disorder, what is the best way to talk to them about body image, food, and eating disorder? I guess just how do you talk to them about that?
If someone were to come to me, like, I know someone right now that I definitely think has an eating disorder, but she's not coming to me and saying, I think I have an eating disorder, she's just having one. With that person, I don't really say anything, because I feel like, now that your question's a little different, but I'm going to give both examples. I feel like if someone's struggling and they're not saying something to me, it's not that it's not my place, I just don't think it's going to be helpful. With an eating disorder, you have to be at a point where you can actually tolerate other people's feedback. If someone's actually coming to you and saying they have an eating disorder, I think as a friend, what I would say is well, what are you gonna do about it? I don't know if it's somebody who's like your age, but if it's someone who's in college, I would say, do your parents know? I wouldn't have told my parents because that wasn't gonna work. So what I say, okay, well, you don't wanna talk to your parents. Is there someone at the counseling center? Or I might say something like, I would definitely like acknowledge that it's very brave of her to tell someone. Do you feel like she's telling you because she wants you to tell her not to have an eating disorder, or why do you feel like she's telling you?
Well, like, for example, if they're getting help, like if they're getting treatment, then like long term as a friend, do you talk to them about food? Do you talk to them about their body, or is it not an appropriate relation?
It's a really good question, and I think it's individualized. With some people, they need reality checks. They need to be told you definitely should be eating. It's great that you're eating. I love that you're healthy. With other people, it's the last thing you want to do, because some people, when they hear that they look healthy, they think that that means that they look bad. So it depends on the person. I always say, ask your friend what she wants. Like, so do you want me to like bring it up to you, and do you want me to talk about food with you and wait, or would you rather just not and just talk about other stuff? So I would ask him or her what they want. The other thing is, if you know someone that's actually going through recovery, I would like just be like, good for you. Like, don't quit. It's really hard. It takes a long time. And again, you guys probably don't really know the process of recovery, because like that's not what you do. The only reason I know it is because I've been through it. I think I know it more because of that than my work, because when I work with other people, I feel like there are similarities, but there's a lot of differences too. And I know that for some people, what I see is that they go through a period where they're trying to recover. I have a college student right now, and she's just gotten into a very like competitive program. She's a junior, so she was doing really well with the eating disorder. I'm really motivated, but it's like the 5th week of school, and she's so stressed out, like with schoolwork, and she injured herself running, so she's all like, I don't want to do therapy anymore. This isn't working. You know, like she went off her medicine, like kind of like you know, she's going through a hard period. And so she's someone that I would, if I were friends with her, I'd be like, just don't quit, or if you're going to quit, go back soon, because not everybody just goes to therapy and gets better. I went to therapy and just kept going to therapy, but like, I was a little older when I started. I was in my like middle, late 20s. I think when you're in college, it's a little different, because there's a lot of different obstacles. For some people in college, just logistically even getting to my office can be difficult, because not everybody has a car. Some people don't want to tell their parents, so like it's a financial issue for some people. Did I answer? What other things do you guys want me to talk about and address as I stand up here?
I was thinking, if you know someone who has suffered from eating disorder and like we're in the process of recovery and you see them relapsing, how do you address that? Like, because it's hard to just sit back and watch your friend who's suffering, and you know you can see that they're hurting themselves. How do you deal with that?
I would say, again, it depends on the person. Like, if she's approachable in it, or she knows that she's relapsing, I would just maybe say, are you doing something about it? Like, are you getting help? Are you telling someone? I don't know if she's in treatment, because people can relapse while they're in therapy. If she's more like defensive or in denial, this is where all these like technologies, I'm like, I love the texting and the emailing, because if I don't want to be direct with someone, I can just send them a text. So with some people, I would recommend like maybe just writing an email and being like, I just want you to know I notice. I wouldn't comment on someone's weight or food or symptoms. I would just be like, I can tell you're having a hard time and I'm worried about you, or I feel bad. Is there anything you want? Is there anything you need? I probably would take that approach. When you're in college, it's hard because you guys like, it's like you're adults and all that, but when it comes to this stuff, you can't be taking like the responsibility on of an eating disorder, because there's a whole, the medical thing, which I know that whoever came last year, she went on about like things that can happen to your body. A lot of things can definitely happen, so you don't want to feel like that person's not getting like attention from an adult, and it doesn't have to be their parent. It could be a doctor, it could be someone at the counseling center, it could be the advisor for your chapter if you have like an adult that oversees the chapter. So that's the only advice I would give too. If like you try to like talk with her and she doesn't really answer, or she's like kind of blowing off what you're saying, I might say something to somebody else. who knows her or knows you that could kind of also steer you in the right direction.
How do you feel about exercising, and is there too much that you can be doing at one time?
It's so hard because over-exercise is such a common symptom with eating disorders, and it's such a, what's that word? It's not clear-cut at all. I over-exercise, so I can tell you for me, how I know the difference, because I still exercise, but I don't over-exercise anymore. For me, it became over-exercising when I would go to the gym when I didn't want to. Like, I'd be like, I have to go to the gym Monday, Tuesday, Wednesday, Thursday. So if it was a Thursday and I was sick, yeah, but it's Thursday, so I have to go to the gym, and I would go. Clearly, that's not a good thing. Some of it, too, is just what you're thinking as you're exercising. If you're thinking, I need to lose weight, I need to burn calories, I need to do this, then you're probably heading in the wrong direction in terms of over-exercise. If you're going to the gym because you're thinking, I'm so stressed out right now and I just need to like run for an hour, I need to go take a class, or I need to go to yoga, that would be appropriate. So some of it's just, you just have to kind of like, it's kind of like you have to ask yourself, am I here right now because I want to be here, or am I here right now because I feel like I have to be? Some people stay too long. Like, I would go sometimes with good intention, but keep going. Like, I would stay. Like, I would get there at 9 o'clock, and at 12 o'clock, I'm still, like, lifting. And I'm kind of like, well, I just, like, the whole morning is gone now. Like, what am I doing? Like, I just totally, like, missed out on things. So that's another issue. If you notice that it's taking up a lot of time and you're missing out on something else that's important to you, to me, that's over-exercising. So if you're being punitive with yourself, or you're forcing yourself, or you're thinking negative body image thoughts while you're in the class or running on the treadmill, it's a flag. Some people over-exercise, but they don't have eating disorders. You know, like, we are people, we live in a society where there's a lot of pressure to look and be a certain way. So I'm sure there are times in my life where I'm not in my eating disorder, but I'm still kind of, I'm probably being a little punitive with myself when it comes to the gym. This year I've had to really work on that because I literally can't go sometimes because I've got responsibilities now that make me actually not have to go. So I have gotten to that point where I don't feel bad about it, I don't feel guilty, and I don't think, oh my God, if I don't go to the gym Thursday, Friday, Saturday, and Sunday, I'm going to gain weight. Like, I'm like, no, I'm not. Like, this woman that I'm working with, she was told she's not allowed to exercise for like 2 weeks. Well, she thinks she's going to gain weight now. And it's kind of like, you have to like not exercise for a really long time for it to affect your body. So some of it's just also addressing those thoughts and being like, no, these are not rational thoughts. These are based on no facts. This is all me being just afraid and not trusting my body. I'll like go on and on about one thing, and I think sometimes I must drive my patients crazy. So, but I don't want to miss anything. Is there anything else that you guys feel like you want to know?
I have a question.
Sure.
I don't know if it's maybe a product of environment or similar mentalities, but can portions of eating disorders be genetic?
I think
Like mother, daughter, something.
I kind of like early on in my eating disorder, I would be like, that's, BS. I used to get mad about that actually at times. I don't know why. Because I guess maybe for me it invalidated, because I don't really know if people in my family actually had an eating disorder. Now that I work with other people and I see what's going on, I look at it as if you live with someone in your family, especially a parent who has poor eating habits or a bad relationship with food, or like focuses on their weight or over-exercises, it's kind of hard not to pick up on that. So when you say genetic, do you mean like chemically speaking, or do you just mean like, because they're actually doing a lot of research on that, and they are saying more and more there's a genetic piece. Does that mean that you're going to get an eating disorder if your mom or your dad or your sister has one? No. It just means that you might be more susceptible, just like with alcoholics. You know, like if there's someone in the family, they say you got to be careful because if your dad is an alcoholic, you might want to just be mindful of that when you're out having fun, and if you notice that you're having trouble with drinking or stopping drinking alcohol. So it's the same concept. Does that answer? It's a good question, though.
How do you avoid that? If you do have someone in your household who is constantly obsessing over that, how do you?
It's hard. I mean, what I do with people in therapy is I try to help them separate. I'll say to them, while like I can understand that you have seen this pattern or behavior and you might think it's the right way to be, it's probably not a good thing. So it's really about like, I think distancing, I think it's very hard to admit to yourself that someone you love or care about, especially if it's a sibling or a parent, has an eating disorder. I think it's scary. So it's really hard. I think you can separate. I think at this age, at this point in your lives, you guys are getting to make your own decisions, which probably like 5 years ago you wouldn't be able to relate. You'd think, well, if my mom isn't eating, then I shouldn't eat that too, right? Like, but now that like you're in college, I think you guys kind of know, right, that you don't have to be like your parents exactly. You can be different than them. So are you asking, like, should you say something to that person? Or are you more saying, how do you just separate?
No, more like just how do you like avoid like picking up their tendencies? Like they're always like talking about it like to you and referring to it. And even if like especially if they weigh less than you and they're always saying how much like how overweight they are, how would you avoid like taking that to your own like
It sucks.
personally?
It totally sucks, doesn't it? Because I think in that situation, you could actually have a good body image and then be like, wait, maybe I should lose weight, or maybe I don't look good. Depending on the relationship, I might say to that person, would you stop? Would you stop stop talking to me about this stuff? Like, do you understand that like you're telling me something about yourself and it's making me feel self-conscious? In some situations, depending on the person, I may just be like, yeah, and kind of nod. Not go along with them, meaning agree with them, but just sort of be like, whatever. Kind of not really. I would sort of want to go like that. So it really depends on the situation. I don't know if you want to, like in your situation, if you would want to do one or the other. Like, do you feel like you want to just say to the person or those people, just shut up?
I don't know. I kind of feel like it wouldn't be like my place like to say it, but I don't know. Like I kind of just don't like know what to do.
In that situation, I would say, and I know it's hard again because if you're talking about like a parent, you're like the whole respect thing. I think throw that out the window. I think if someone is, including a parent, if someone's putting their issue on you or bringing it in the relationship in a way that upsets you, I think there's a way you can say it. You might say it differently if it's a parent than a friend, but I don't think it's disrespectful or out of place. I think in some ways it can help both the person and you. Like, I definitely have worked with people through the years who have developed an eating disorder as a way to say to their family, like, there's something going on in my family. It's not just me having an eating disorder. Like today, I was sitting with a very young girl, a 12-year-old girl, and one of the questions that I asked her was, does anybody else in your family have issues? And she's like, yeah. And I'm like, well, maybe this is an opportunity for you to not only work on your own stuff, but like, now like you can sit in sessions and say to the other people in the family, yeah, but you do that too. Because I think she feels like, oh my God, look at what I did to my family. But it's kind of like, no, you didn't do anything to your family. You are just a product of the environment. Does that make sense?
Is it possible for someone to like fully recover from eating disorder?
And somebody asks me that every time I go out and talk. When you say that, can you just say what you mean? Because the way I define it might
Like if you know someone who did like a long time ago, is there a possibility they can come back?
I mean, I feel like I'm fully recovered. I definitely have worked with people who have. I think, to me, being fully recovered, this is how I understand it, for me and for other people. If I know that my tendency when life gets really hard is to focus on my weight. Okay, so I know that about myself, but being fully recovered means, like when I first have Andrew and I'm like, oh my God, I should lose weight. What it means is, it's just, to me, it's a signal. If I have the thoughts and I go and act on them, I'm not fully recovered. I haven't acted on the feelings in a long time. I went through thyroid cancer at age 35, and if you guys know what thyroids do, and I lost my thyroid, and I was like, holy shit, like, what am I gonna do? Like, I was so afraid because then they have to put you on medicine and they don't know how much you need, and all I'm thinking is, oh my God, like, I'm gonna like gain weight, or I'm hungry all the time, or I'm not hungry, I don't know what to do. I didn't go back into my eating disorder. I just talked about it. I definitely struggled with the thoughts and was really stressed out, but to me, that doesn't mean I'm not fully recovered. I kept myself healthy, I kept myself moving forward, I kept going to work, and I was okay. So sometimes people look at it as in terms of amount of time, like I'm 5 years cancer-free, that means like I'm cured. With an eating disorder, I don't look at it like that. I think every time something happens in my life and I've proven to myself that I'm not going to go back in it, I think I'm fully recovered. Does that mean that I'll never, ever, ever, you know, like maybe when I'm 50 and I'm going through all these other crazy hormone things, I might, who knows, something might happen. But what I would do is I would just get myself into therapy. And I would tell someone, I'm at the point where I don't feel ashamed anymore, so that's another factor. Like if you know someone that's fully recovered but they still feel ashamed about it, it's not that it's gonna come back. It just means that they might have a harder time asking for help if they need it. I don't have a problem asking for help anymore. I don't think there's anything wrong with asking for help, and this is what I do for a living. You know, so to me, it's like, it's my responsibility to keep myself healthy if I'm going to keep helping other people. Does that answer your question? Does anybody else, like, understand what that means, being fully recovered, or have a different way of defining it? Because I know that I'm just I'm using myself and maybe it's people I know, but does anybody else have a way of understanding what that means? Or any questions about that? It's a really good question. I think a part of what the week is about is educating and prevention, but I think National Eating Disorders Awareness is about also just instilling hope and really just saying to you guys that, like, anything is possible. I did not think I was ever going to be able to just sit down to a meal and not worry. I struggle with food for more years than I've been here. Like, I'm 41 and I struggle with food for like at least 25 years. So all through my life, I thought there's no way I'm ever gonna like be able to just be normal with food, or I'll never be able to miss a day at the gym. And when I see that I actually can do this, it's the best feeling ever. It like makes me feel hopeful for myself and for people that I work with. So
I feel like a lot of times eating disorders like are only like, it's like only women have them. Like, what about men? Like, do you, I know like they can, but like, can you like maybe like talk about maybe some patients? Because like I feel like I don't know if I've ever necessarily met a guy who has had an eating disorder.
I think one of the things that sucks about all that is like a lot of men have them.
Yeah.
But I don't know why there's a stigma. Like, oh, but that's a girl's thing. It's so, what does that have to do with? There are things about being a woman that make us maybe more susceptible, but with the guys that I work with, I have a few right now. And what I'm noticing is the longer I'm in practice, the more I get men, and I like love it. I'm like, I totally relate to what they're saying. Like, there's one that I'm working with now. We have a similar childhood background, and like everything he says, I totally relate to. It's not any different. He struggles with overeating. He struggles with trusting his body. He struggles with what he looks like. He's afraid if he eats certain foods, he's not going to be able to stop. So to me, there's not any difference. The only difference is that men have a harder time asking for help. There are some different issues that can lead to eating disorders. Like, for instance, with men, some of them have issues with, like, not being thin, but being, like, well, I don't know what word you would use, but, like, they want to look good. Like, they want to have muscle mass, or they want to, like, be defined. There are certain sports, like wrestling is definitely a very common sport where there's eating disorders. But then there's also men who are involved in theater and ice skating and gymnastics, and they also will struggle. So to me, what I would say is, if you know a guy that's struggling with eating disorder, just sort of smack him on the head and be like, you have nothing to be ashamed of. Like, it's fine. Like, it doesn't make you less of a person, and there's no reason why you can't get help just like someone else who's a woman could get help. I think if they do statistics now and they did it in 10 years from now, the percentage would change. I think as people talk more and more about eating disorders, more and more men are going to get help. Like this one guy that I work with, he's at least 10 years older than me. And he hasn't even like touched his eating disorder because he just started working on it last year. And one of the things that he gets so upset about is, I wish I had done this sooner. Like, this totally stinks that like I'm struggling with this for so many years. Like, it affects him everywhere. So I like just look at him and I say, I feel the same. I mean, I totally get what you're saying.
Is it like only an eating disorder or if it's continuous, if you're constantly doing it, or like I have family that like when they go through really emotional times, they definitely just turn to food, but then they're fine, but then something else happens and they turn to food, and you feel like during that time you can't really talk to them because they're so upset that they're just like, just let me eat because like I'm upset, I want this, and it makes me feel better, and so you can't like talk to them during that time. So is that just an unhealthy eating habit, or is that a disorder or heading towards a disorder?
It could be either. Some people, I know for myself when I was from age 7 to like 12 or 13, probably I wouldn't have been like met the criteria for an eating disorder if you went down the checklist, because it would kind of come and go. I call that more like emotional eating. I think it's a problem in the sense that what it does is it means that whatever people in your family are going through, they're not really addressing their emotions. So it's sort of like a defense. I think where it can feel like a disorder is that it might make you as the family member feel pushed back or pushed away. Because when someone is upset, you don't want them to shut down. You want them to talk. And I think that can be where it feels like a disorder. It doesn't necessarily mean that that person's going to end up in a hospital. Would that person benefit from therapy? Definitely. I definitely see people who might not like meet the criteria to be an eating disorder, but they have, I say, eating disorder tendencies, or I would call it disordered eating patterns. And I think if it's affecting your relationship with yourself or someone else, then there's a reason to do something about it. And it's definitely fixable, workable. It's not like you can change those ways of coping if you want to. What are some other things that you guys want me to talk about?
Could you maybe talk about like some of the, I don't know, like atypical situations, like things that go along with eating disorders other than just like depression? Like I know that some people will restrict when they're like happy and like binge when they're upset. Wait, did I say that right? Yeah, yeah, like kind of backwards. And then maybe like I don't know, like post-traumatic stress. I guess you kind of did like touch on that. Like body dysmorphic disorder, OCD. Like I know there's a bunch of like atypical like different disorders that go along with it. There's
Definitely a lot, and like one of the things that I notice a lot in my practice is some of the girls who aren't seeing me for like depression and eating disorders have other issues, like ADHD is a big one, anxiety. What do you want me to say about it? You want me to just say that it happens, or
there's just like different mentalities that go along with it? Like, would definitely. You like approach it differently if you were like to talk to somebody?
Yeah, I approach it differently with every single person because to me everybody is different. You know what I'm saying? Like, I have worked with a few women through the years who I wouldn't say are depressed, but they're so anxious, or they are so like with their ADHD stuff, they're like they have trouble focusing that they might like not eat if they're excited because they're so distracted, or they might eat all the time if they're feeling down or like bad about their self-esteem and stuff like that. My approach is probably sort of the same in the sense that I say it's still like a defense. Even if you're not depressed and then using food in different ways, you're still doing something. You're still defending from knowing or dealing with some type of emotion or some type of issue in your life. So sometimes I think about eating disorders as it's a way to, it like makes your feet up off the floor almost. Like you can't be grounded if you're in an eating disorder because you can't really be fully present. So even if you're not depressed, if you're really anxious, or if you're easily distracted, or if you're struggling in school, or like this woman that I know that didn't eat at work, she's so stressed out at work. She's not depressed. She's just like so freaking stressed out that like she just doesn't eat because she's like just so depressed or not so stressed out by like the responsibility that she has because it's a new job for her. She's not that much older than you guys, so she's worried about failing. So with her, I just might be like, okay, what can we do to help you to manage your stress but still take care of your body? I would like say, let's work on coping strategies. When you're having a really, really bad night, maybe what you need to do is this, and we'll come up with different ideas. Maybe you need to call somebody, or you need to take a break, or you need to talk to like the supervisor on the unit. I might do that. I don't think it's any less of a disorder. If you don't have depression, you have other like atypical. I think a disorder is a disorder. If it's affecting your functioning in life, or it's making you unhappy, or if it's hurting you, to me that's like a disorder and it needs attention. Yeah.
Are there any other types of disorder, like things that you don't always think about? I had a friend who was like, her eating disorder was like laxatives. She took them all the time. Are there any other things besides, like, not saying typical, but the most popular things you think of when you think of eating disorder, the binging and purging and like anorexia? But are there any other things?
You mean
that
like symptoms that might
symptoms or
alert?
like things that, like outlets people use that you
Like behaviors.
yeah.
I'll say, I just hesitate to say because one of the things I worry about is I don't want to give anybody any ideas, so I'll say, but definitely I don't think you should do any of these things. I have to think a second. The one that I hear more about lately is spitting and chewing and spitting. It's not like, it's kind of like she might put the food in her mouth, she doesn't swallow it, but she spits it out so she won't swallow it, and then she does that so she won't like throw up. It's like she wants to have the taste of the food in her mouth, but she won't let herself actually enjoy the food. I think that's one that I've heard more about in the more recent time. There's a lot of like, how do you call this? But like when you sit at a meal, there's different quirks or tendencies. Some people are very like particular about the food on their plate, so they might be very like compulsive about where food is, or you can't have your food next to each other. Like you have to separate. I don't really know. I'll probably think of more things when I leave tonight, but
Overeating too, right? It's not just
Oh,
not eating, but
definitely. Like I definitely, again, when I was in my early childhood, my eating disorder was nothing about restricting. It was the more I ate, the better I felt. Like I definitely, and I even when I was going through the anorexic stuff, definitely compulsively ate. Like one thing I want you guys to know or understand is that I don't think anybody's just one thing. I think if you have an eating disorder, most likely you've had symptoms of anorexia, you've had symptoms of bulimia, maybe symptoms of binge eating disorder. It's not like, oh, I'm anorexic. I mean, maybe some people, but the longer you have an eating disorder, the more it kind of like goes all over the place. Because you set yourself up. If you don't eat for a long time, you're going to want to eat and eat and eat. And if you eat all the time and then you stop eating compulsively, sometimes people go the other way. And that's why therapy and like seeing doctors and nutritionists is so important, because you need someone to kind of help you to understand what food is and how to have a good relationship with it. Does that answer? Are you asking because you're wondering if things you notice are considered symptoms?
Oh, I think I'm just interested.
Oh, okay. It's a good question. I know I'll go home and think, oh, I forgot to tell her that.
I know we're not supposed to compare ourselves to people in the media, but how do you do that if, like, let's say I see a commercial and it actually does look good. Like, I think she looks good, but she's obviously smaller than I am. Like, how do you deal with feelings like that you're not good enough?
I would say that's when you should get mad at the media and be like, why are they picking all the same, like, I watch TV shows like 90210. I love that show. Like, it probably sounds ridiculous at 41, but I love that show. But the thing is, I sit there the whole time. I'm like, she's so thin. Like, what are these girls doing? Like, or she looks like she lost weight, and I think it's bad. I get mad. When I was in college, I did what you did. I would, or what any of you might do. I would think, oh God, maybe I should look like that. I would just say to you guys, the media is not reality. If you look at the body types on TV or in magazines, and then you walk down the street, or even if you sit in your sorority and you look around the room, what you're seeing in the media is not realistic. My assumption, and this might not be a very nice thing to say, but my assumption is that a lot of people who work in the acting or modeling field have eating disorders. It's just my assumption, and I might not be right, but I think I do that as a way to protect myself from taking it on. I don't think there's anything good about what you're seeing when you look on the TV. And what I would just say to you is, it's something people do when they struggle with body image. They compare themselves to other people, and a lot of times it's usually because there's something else in our lives that we don't feel good about. But it's so easy to get down on ourselves with weight because it's so concrete and it's so easy to change. Like, my self-esteem issues really weren't about weight growing up, but that's the area that I could pay attention to because it was easier. I was really struggling with identity issues. I didn't feel like I fit in. I didn't really understand how to get what I needed. I didn't know any of that. I just was like, yeah, I need to lose weight, or who cares what I eat? I'm just going to eat, it'll make me feel better. So it's a tendency that unfortunately a lot of us have, and the media just sucks us in. So if you ever went to one of these conferences that I go to on eating disorders, we like, 600 people in a room are like, they shouldn't be doing that, and why are they putting that on TV? And we get so mad. And they still do it anyway. Like that 90210 show, I'm like, does anybody on that set eat? Like they're like, I'm like, what are they doing? I don't understand. I'm sure it's not the only show, but it's the one that I watch that's not probably appropriate for my age group, but isn't it on tonight too? It's on tonight. My DVR's reminding me at 8 o'clock would be like 90210. Yeah.
How do you tell the difference between being conscious and watching what you eat and saying you have an eating disorder?
It's so hard. I was just talking to somebody yesterday, and her mom, I've just met her, and her mom called me. I think my daughter has an eating disorder. She made her kid go to CHOP and all this stuff. I don't think she has an eating disorder. I think that with her, she was struggling with food, and she didn't feel healthy. She didn't feel like she likes to do sports, and she didn't feel like she could. So she very, very gradually lost weight, like over a 3-year period. So when I was asking her, well, what are you striving towards? What are you trying, like, what's your goal weight-wise? And she said, it was very appropriate. Like, I didn't think she should be losing weight at this point, but at the same time, her goal seemed feasible. So I would just say it's a fine line. And again, a lot of it's not the numbers, it's more how you approach it. If you feel like you want to be healthy or make better choices with food, that doesn't mean that you're going to have an eating disorder or that you have an eating disorder or that you'll ever get one. I think the problem with weight loss is women, we can take it too far because it kind of is nice when people are like, you look good, or did you lose weight? I got that all the time. In high school and in college, I'd come home and I'd keep losing weight, and like people were like, oh, you look so good. And it was like, oh my God, they're saying that I look good, I have to keep going. So a lot of it's just maybe also deciding for yourself, I'm not going to listen to what anybody says. If I feel healthy and if I have energy and I feel good, then that's okay. That doesn't necessarily mean that it is, because some people with eating disorders are in denial. But like, there are definitely people who are able to make changes with food, and it has nothing to do with an eating disorder. Does that make sense? I know, yeah.
I know that something that's becoming really popular now, especially in college, is students are using Adderall to give them like extra energy to get their schoolwork done. But like another thing that goes along with it is it suppresses your appetite. And like I know a lot of like sorority girls do it to lose weight. Is that considered?
I was gonna say that there's when she was saying about atypical, that's one I didn't think of. It's not a good thing. I think it can definitely, it's an eating disorder. To take something to suppress your appetite, it's like, it's not, it doesn't make sense. For some people with that, they become addicted to the drug, I think, don't they? Like, if they keep taking the Adderall, you can get addicted. So I look at that more as you're definitely having an issue with food if you're doing that. But I'm also thinking you're also heading in a direction that has more to do with drugs, maybe. And again, it depends on the person.
So there's a fine line.
It's definitely, if someone's taking Adderall to suppress their appetite, they definitely are not having a good relationship with food and weight. And they're going to measures that are potentially dangerous. But some people might dabble with that and then realize this is not a good thing and might stop. So some of it too depends on, is this person continuing to do that, knowing that they're messing up their metabolic system? If they are, I would say that's a problem. I don't understand this Adderall thing. Like, how do people on campus even do that?
I know a girl I was friends with in high school, I'm no longer friends with her, she had ADHD, and her doctor gave it to her, but there were a lot of days where she didn't want to take it, and she would give it to people that weren't prescribed.
So that's how you get it. Like, people who get it, either like they sell it or they give it away. And
Or some people like fake the
Yeah.
tests too, so that way they test positive for it, and then they can get spooked.
the thing with Adderall too, I was talking to somebody about this today. I'm not seeing her for an eating disorder, I'm seeing her more for ADHD and depression. The longer you take it, eventually it doesn't even do that. Like, that suppressing the appetite thing is just in the beginning. Like with drugs or side effects, but it doesn't actually last long term. So it's not even like, it like doesn't make any sense. And the thing is, it's a very addictive drug because it's a stimulant. So if you know someone that is doing that or you've done that, I would just say don't go there. Like, it's like a dangerous, to me it's like dangerous, because you're not only making a decision in your head to like be disruptive, but you're actually taking a substance to like not eat. I think that's potentially dangerous physically. You know what I mean? Like, you don't want to be messing with that kind of stuff. So it's another like challenge in the eating disorder world in terms of helping people, because it's one more thing that people can do to be in symptoms.
This is kind of the other side of that. I know people were talking about like legalizing marijuana as something to make people who aren't eating eat. So how do you feel about like using a substance to make people who like aren't like logically thinking I should be eating, but like tricking them into eating?
I think that like, are you saying that people with eating disorders are like?
Yeah, like
I haven't actually heard of that.
Oh, like people who like won't eat, like smoking marijuana to make them like hungry and then make them want to eat.
I would say again, it's kind of like it's not a good idea, because it's not really going to solve the problem. It's sort of like a false. To me, it's like you're not really addressing the issue. Like if you have to take a substance to feel hungry, we all like. The one thing I've learned this year with hunger is, I don't know if any of you have babies in your life right now or like babies, but the one thing that I'm seeing is that we're actually born with the ability to feel hunger and know when we're full, and babies like know when they're hungry and they know when they're done. So we're born with that. What eating disorders do is they take that away from us. They shut that down. Like they no longer allow us to understand our hunger or what it means. So to me, it's kind of like, it's like another form of putting something in your body to make yourself feel something that you should just be able to feel because you feel it. So I would support that with someone who maybe is having appetite problems because they're sick, like people who are going through like chemotherapy or illnesses that have issues with hunger. I would be okay with that. But if someone's actually using it to get better from an eating disorder, I don't think that's a good idea. I've never heard of that. You learn something every day. Yeah.
When you say you don't really understand your hunger anymore, what exactly does that mean? Like, and if you do feel hungry, how do you suppress those feelings and deal with that? Because it's not really, I guess, a good feeling to have.
Eventually, you mean how does someone with an eating disorder do that?
Yeah.
I think what I did was I would feel hungry, and then I would just say to myself, well, if I keep not eating, it'll go away. The longer you don't feed your body, you can actually shut it, like it just goes away. Like you just literally can stop feeling your hunger.
You just don't feel hungry anymore?
I don't know if any of you are Jewish. I'm Jewish, so I don't know if anybody in this room celebrates the high holidays.